the inheritance of autosomal recessive and autosomal dominant conditions. So some genetic conditions exhibit a simple inheritance pattern called Mendelian inheritance. This inheritance only occurs where the disease is caused by a single abnormal gene on one of the non-sex chromosomes. So this is the chromosomes that are not the X or Y chromosome. So these chromosomes are called the autosomes. Two examples of diseases that are caused by a single gene passed on from somebody's parents are Huntington's chorea and cystic fibrosis. So the difference between these two conditions is that the gene for Huntington's chorea is dominant over a normal gene, and the gene for cystic fibrosis is recessive over a normal gene. So this basically means that in order to have the disease of Huntington's chorea, you only need a single copy of the disease gene because it will override the other copy of the gene that you have that's normal. Whereas in order to have the disease of cystic fibrosis, both of your copies of the gene need to be the disease gene. Because if you only have one disease copy, the other copy that you have, which is normal, will override the disease copy. In this scenario, you're called a carrier because you don't actually have the disease, but you do have the capacity to pass it on to your offspring. So we refer to diseases like cystic fibrosis as autosomal recessive, and diseases like Huntington's as autosomal dominant. So now I'm going to go through how you actually calculate the risk of one of the offspring having an autosomal recessive condition. So in order to calculate the risk of passing on an autosomal recessive condition, it's really helpful to draw out an inheritance pathway. By using this method, you can always work out the risk of various outcomes based on the genetic status of the parents. So I'm going to use some examples in order to demonstrate this method that could help you in your exams and also in explaining things to parents in real life practice. Firstly, let's consider both parents are carriers of an autosomal recessive condition. Each parent has one disease gene and one normal gene. And as a result, they do not have the disease, but they do have the potential to pass the disease on to their children. So let's label the copies of the gene that could be inherited from the parents as copy 1 and copy 2 from the father, and copy 3 and copy 4 from the mother. There's always 4 possible outcomes to the inheritance of this specific gene. Outcome 1 is copy 1 from the father and copy 3 from the mother. Outcome 2 is copy 1 from the father and copy 4 from the mother. Outcome 3 is copy 2 from the father and copy 3 from the mother. And outcome 4 is copy 2 from the father and copy 4 from the mother. So let's say copy 1 and copy 3 are the autosomal recessive disease genes, and copy 2 and copy 4 are normal genes. So outcome 1 has 2 copies of the gene that codes for the disease, and therefore this person would have the disease. So outcome 2 has 1 copy that codes for the disease and 1 normal copy, and therefore this person is a carrier, just like their parents. Now outcome 3 again has 1 copy that codes for the disease and 1 normal copy, and therefore they're a carrier as well. Now outcome 4 has 2 normal copies of the gene and therefore is free from the abnormal gene and doesn't have the disease and is not a carrier. Therefore the children of these parents have a 1 in 4 chance, or 25% chance, of having the disease, a 2 in 4 or 50% chance of being a carrier, and a 1 in 4 or 25% chance of having normal genes. So by doing this, you can calculate quite easily the risk of the children either having the disease, being a carrier, or having normal genes. So now, finally, I want to give one scenario that illustrates calculating the risk of passing on an autosomal dominant condition. We can use the same method that we did for autosomal recessive conditions. So for example, let's say we want to know the possible outcomes where one parent has a condition and the other parent is disease-free. We need to know whether the affected parent has 1 or 2 copies of the gene for the disease, because either way they'll have the condition. So we can find this out through either genetic testing or asking about the affected parent's own parents. If the affected person had 1 affected parent, we know that they only have 1 copy of the disease gene. However, if they had 2 affected parents, it's possible that they also could have 2 copies of the disease gene. So for this example, let's assume they only have 1 copy of the disease gene. So again, we start with 4 copies of the gene, 2 from each parent, and let's assume that copy 1 is the gene for the disease. Outcome 1 is copy 1 and copy 3. Outcome 2 is copy 1 and copy 4. Outcome 3 is copy 2 and copy 3. And outcome 4 is copy 2 and copy 4. So therefore, outcome 1 has the disease, outcome 2 has the disease, outcome 3 has 2 normal genes, and outcome 4 has 2 normal genes. So therefore, the children of these parents have a 2 in 4 or 50% chance of having the disease, and a 2 in 4 or 50% chance of having normal genes. So I hope this explanation has made it a lot clearer about how you calculate the inheritance of these single gene diseases. If you like any more information or you're a bit confused, please post in the comments below. I'd be really grateful if you could like this video, subscribe to the channel for more videos, and also check out the Zero to Finals website where there's loads of resources at zerotofinals.com. And I'll see you next time.